this really tough crisis over these last weeks. It's been a lot of times cold and rainy, but now we are starting to see a change. And it's something that each year we would normally really be looking forward to, and I think we all are now too, but it comes with a twist this time, which is the way we have to handle it, the way we have to be smart about it. So we now expect for the rest of April temperatures to be generally in the 60s, going into May, going into the 70s. That's wonderful for so many reasons, but it calls upon all of us to be really smart, because when you start to feel that nice weather, it's in all of us. We want to go out even more and more. We want to do things with our families and our friends. We want to play sports. There's so many things that feel natural when you start to feel that warmer weather. We're going to have to be smart about always keeping the right limits on things as we fight back this disease. This is a really tough foe we're facing, and I think it's been proven many times over. We also know this is not a fight that goes on forever. It's going to go on for months, thank God, not years. It's something we're going to be facing for a while. But we got to be smart about it. We got to be tough about it, and we got to be disciplined about it. And look, I'm saying that to you really with a lot of admiration, because New Yorkers have been absolutely amazing. And I'm trying to let people know, not just in this city, but far beyond, that there are so many stories of heroism here in this city, starting with our healthcare workers and our first responders, and so many acts of kindness that we've seen in our city. But there's also an everyday heroism that all of you have practiced, because this should have been the toughest place in all of America to practice social distancing and shelter in place, and yet you've done it to a remarkable degree. And that is why we are beating back this disease. That's entirely why. I need people to understand it. There's no vaccine, there's no cure, so it wasn't that medical science beat back this disease. You beat it back. We got a long way to go. But the fact that we're seeing any improvement at all is because of you. Now you're facing a new test. Got to do it even more, because it's going to be harder, honestly, during the nicer weather. It's certainly going to be harder for our young people. But we got to do our damnedest to keep these smart restrictions in place, keep the limits, keep the balance, till the day that we see things are really getting better, and then we can start to open up some more. Do not underestimate our enemy. This is a horrible disease. We've seen the toll it's taken. And if we let it back in the door, it will reassert itself. We've seen it around the world before. Let down your guard and this disease comes back with a vengeance. We can't let that happen. So to all New Yorkers, it's going to be a beautiful day today. You can enjoy it a little bit. You can take it in for a little while, but always while practicing social distancing, always with that face covering on, and just for the amount of time you need, and then get back indoors. And we're going to fight together to get through this. Now remember, when you do that, when you practice those smart rules and you bring it to life and you fight back this disease, of course you're protecting your own family, your own friends, the people in your life, but you're also protecting those heroes we talk about so often. I know you care about our frontline heroes. I know you honor our healthcare workers. Remember, every time you practice social distancing, every time you actually stay home, even when you wish you didn't have to, you're actually protecting those heroes too. On Friday night, I went over to Elmhurst Hospital in Queens, which has been the epicenter of the epicenter. And I was there for the 7 o'clock clap, and it was a beautiful thing when you see all the first responders come out, the neighborhood come out to salute our healthcare workers. This is one of those amazing things that has come up naturally in this city and is a statement of who we are. I tell you, our healthcare workers appreciate it. They feel it. They feel your love, and it means so much to them. We got to keep showing them that love. But the way to do that is to help them. Help them by practicing those smart rules to protect everyone. And the other thing we have to do to help them, which is what I'm focused on, the entire city government is focused on, is continuing to get them the reinforcements they need. They have worked through such a tough battle A lot of them, understandably, are really tired, but they never stopped working. They never stopped saving lives. So we are now getting them much greater numbers of reinforcements to give them a break, to give them a rest, bring in new folks to help shoulder the burden. So as of today, we've added over 1,400 volunteer healthcare workers to serve New Yorkers. And these are folks who are healthcare professionals who are coming here. They're volunteering to go to the front. They're volunteering to go where the situation's toughest. They're volunteering to go into those emergency rooms and ICUs. I want to be clear, we are not asking them to go without pay. We do compensate them. But these are folks who had no obligation to go into places like Elmhurst Hospital or other hospitals that are bearing the brunt. They're choosing to do it because they want to save lives and protect people. Some of them are from right here in New York City. Some of them are people from all over the country, packed up their cars and drove here, took long flights, had to say goodbye to their families for a period of time to be able to save lives here. They're very noble people. And we are so appreciative to all of them, 1,400 who have answered the call. They will be assigned to over 40 hospitals and over 40 nursing homes in this city where the need is greatest. And they are another kind of hero coming to our relief. So if you meet any of these folks, and I've had the honor of meeting some of them, just really let them know how much we appreciate their sacrifice as well and the way they're helping our homegrown healthcare heroes to get through this crisis. Now, these reinforcements will help us a lot, but we still know there's a lot of places that are bearing the brunt, a lot of neighborhoods that are hardest hit, a lot of hospitals that are hardest hit. And one of the things we're seeing in this crisis is that our independent hospitals are amongst those bearing the biggest brunt here. They are smaller hospitals, community hospitals, hospitals that for a long time have not been able to do all the things they wanted to do because they haven't been given the financial resources they needed. And these hospitals, like our public hospitals, our city hospitals, are in many of the places that have had it toughest. So unlike some of the big hospital systems that have, somewhat more resources, these hospitals have really had it tough, and we are stepping up to help them further. We're sending at least 600 additional medical personnel to 11 of the independent hospitals that need it most. And we're taking volunteers from our city medical reserve corps, and we will continue to recruit more and more to make sure that these independent hospitals get the relief they need. This is going to be ongoing. We know, again, this crisis isn't over till it's over, but we know these hospitals have served their communities with so much devotion for a long time, even if they didn't have the resources. We've got to be there for them, and we will. Now, talk about reinforcements. I think probably the most powerful, the most moving example of reinforcements has been the arrival of our United States military medical personnel. This is something I fought for and called for many, many weeks because it made so much sense. These are the best of the best. Members of our military who serve all of us, medical personnel, have been trained to deal with the toughest conditions. People who have long since made a pledge to devote their lives to saving others. We needed them, and we needed them badly. And slowly but surely, the numbers have been growing. Think about what it means. I've talked to a lot of our doctors and nurses and healthcare workers in the hospitals hit hardest. I've asked them, what does it mean to see the members of our armed services arrive? What does it mean for you? And what I hear over and over is people say it's the most amazing sense that help has finally arrived, that these heroes have come to give everyone a shot in the arm, give everyone that support. They bring an incredible positive attitude, the can-do attitude we associate with our military. And for a lot of the frontline healthcare workers who were just feeling so tired and so worn, imagine that uplift when they look down the hallway and they see doctors and nurses in their fatigues coming to help them. It's really, really beautiful. It's really beautiful and moving. And it's meaning a lot to our healthcare workers. It gives them a sense of security. I always say, we always grew up with that phrase, when the cavalry comes. Well, the cavalry did come. The reinforcements did come, and it's making a huge difference. The first wave was almost 300 medical staff, and we heard amazing stories from that first wave of the impact they made and the relief they gave, the talent they brought. That number's almost doubled now. And what we are seeing is the impact is great. And I have an example for you from Bellevue Hospital, where I always have trouble with this word, anesthesiologists and neurosurgeons went into the ICU. So again, remember, they went right to the heart of the toughest situation in the hospital. They came in from other parts of the country and plugged in right away, and they wanted to go where the situation was the toughest. They came in and helped immediately, including some medics who had served our nation in Afghanistan. So these are folks who have been through a lot, who have had to practice medicine in the midst of war, and they brought that skill, that poise, that amazing commitment to our public hospitals. Team of military nurses arrived at Bellevue, and they were asked what shifts they were ready to cover. And their answer was days, nights, weekends, 24/7. That is the spirit that our military medical personnel have brought. And you can imagine the hope that that generates, the feeling that generates in our healthcare workers. So I could not be more appreciative to everyone in the military for this incredible assistance. And they've sent us doctors, nurses, respiratory therapists, dietitians, physicians assistants, and many other specialists. And the hospital leadership all tell me those specialists bring so much to the equation that we need. I want to just read this honor roll to you. Elmhurst Hospital, obviously the hardest hit of all. I know there's been elements of the Navy, the Army, and the Air Force there. Queens Hospital, the Air Force and Army are there. Bellevue, Navy is there. Woodhull, Navy. Kings County, Navy. Lincoln Hospital, Air Force and the Army medical personnel. Jacoby, Air Force and Army as well. Harlem Hospital, the Army. Coney Island, the Army. North Central Bronx, the Navy. I got to tell you, it's so moving to me. And I've talked to some of our soldiers and sailors and airmen, and they just bring such an amazing spirit. And I'm thankful to every single one of them. When I get a chance to thank them on behalf of all 8.6 New Yorkers, it moves me. It's one of the best examples of our nation doing what we really need in this moment of crisis. So those are some of the things we all can do and your city is doing to support our frontline heroes. But there's something we can do additionally to support each other and protect each other. And in this case, it is about the extraordinary opportunity to help people to recover from this disease. And what we need is that folks who have tested positive for COVID-19 and have recovered, we need you to give blood. Your fellow New Yorkers need you, because what we're finding so far, and these are studies that are going on, but they are promising, is that the plasma in your blood, if you've tested positive and recovered, the plasma in your blood can help others. There are a number of our public hospitals that are participating in plasma trials, using it with patients currently undergoing treatment, and we're seeing promising results so far. The New York Blood Center is doing extraordinary work right now as part of this effort, collecting the blood and making sure that this opportunity to protect others grows. So anyone who has tested positive and recovered and you're in a position to give blood, we need you. And please give blood as quickly as possible. You can go to nybc.org/COVID plasma, and you will be doing another New Yorker a great, great favor. Now, I want to go back to this challenge we're going to face as we all navigate the spring weather. And again, the spring weather is a beautiful thing. And it's going to feel like we're going back to normal, but we're not going back to normal until we have proven that we have beaten back this disease. We're not going back to normal until we have those healthcare indicators show us that things are truly getting better. We're not getting back to normal until we are clear that we can do it safely. We do not want to see this disease boomerang. We do not want to see it come back with a vengeance, so we're going to do this the right way. So my message to people is, please be smart, be careful, take care of yourselves, take care of others, keep going with social distancing, keep staying home. Let's do this the right way. Now, for anyone who doesn't understand that message, even though I have said it 1,000 times, I know you have heard it in so many other ways. If you don't understand that message yet, we're going to have to get tougher and tougher. NYPD, which is regaining strength now as more and more of our officers are coming back who were sick with COVID-19. Parks Department, same thing. They will be stepping up enforcement today and in the days ahead. They will be targeting any hotspot, any place that there's been complaints before. Now, let me make this part really clear. No one wants to give you a fine, okay? I don't want to give you a fine. Our police, our Parks Department employees, no one wants to give you a fine. We're going to keep giving you warnings before ever having to give you a fine. If you just listen to the warnings, you'll never get a fine. If a police officer or a parks enforcement agent or anybody else from the city says, hey, you're not practicing social distancing, you got to separate, or hey, that's a gathering, we don't allow gatherings, just do what they say. By the way, if your fellow New Yorkers remind you, do what they say, listen to them. But if someone ignores the instructions of our enforcement agents, we will give fines. And now those fines can be as high as $1,000 per incident. Now, look, if you said to me, we're in the middle of a horrible crisis, we're in the middle of an economic crisis on top of that, people don't have money, I agree. That's why we don't want to give fines. But the first thing we have to do is save lives. The first thing we have to do is protect each other. And people have been warned and warned and warned and educated. And you'll be warned again. But listen, this is serious. It's going to get harder now with the nice weather. And so please, everyone, take it seriously. If people do right here, just do right by each other. Just be respectful of each other. There won't have to be a need to give fines. And if people ignore these warnings, there will be. And we will if we have to. And remember, I'm going to be clear about this, I need, everyday New Yorkers, I need all of you, if you see violations of social distancing, if you see gatherings, you got to report them. Sometimes people may feel a little self-conscious, like there's something wrong with reporting what other people are doing. I understand that. In normal times, maybe you could feel that. I don't agree, but you could feel it. In wartime, in a time when people's lives are threatened, in a time where if we don't get it right, this disease could come back and kill so many more, I'm sorry. This is not snitching. This is saving lives. You got to do it. If you care about protecting human lives, if you care about protecting your own family, we cannot let people start to have gatherings, and we cannot allow people to ignore social distancing. So there's something very easy you can do. Of course, at any point you can call 311, just call in what you see. And you can live by that same idea we talked about in the fight against terror. If you see something, say something. And by the way, when we were threatened with terrorism, no one doubted that it was right, if you saw something, to call it in immediately. Well, this is just the same reality. We just have a different enemy, an enemy we can't see, but an enemy that's taken so many lives. So you can call 311, or you can just snap a photo, write in the location where it is, and text to 311-692. Just send that photo along, 311-692. Or you can use the 311 app, or you can send it to nyc.gov. We need those photos, we need those locations, so we can enforce right away. Okay, let's talk about what we do every day, which is tracking where we stand in fighting back this disease. And again, every time we make progress, it's because of what all of you are doing. This is everyone's fight. So these numbers show you how we're all doing together, but take them personally. The more you do, the better we're going to do in terms of showing progress and beating back the disease and starting to get to normal. Yesterday was a mixed result, unfortunately. We had two of our indicators down, which is good news, but one went up. Today, also a mixed result. Daily number of people admitted to the hospitals for suspected COVID, that went up from 261 to 317. Daily number of people in ICUs across our public hospitals for suspected COVID, that went down from 880 to 849. Percent of people tested positive for COVID-19. Citywide, that went down from 42% to 38%. But at the public health lab, it went up from 72% to 84%. So we have a mixed bag. We have seen in the last couple of days some of the indicators moving in the right direction. So anytime you see progress, it means something that you're doing is having an effect. We need to make that happen even more. So we need to see all those numbers move in the same direction for a prolonged period of time. It means keep fighting, buckle down, keep fighting. We're on the right path, but we got to do it even more. Now, let me conclude with this. Many times I've asked New Yorkers to hang tough, and I've asked you to do more. I've asked you to step up, and you've been doing it, and God bless you for that. We've asked our healthcare workers, our first responders, to step up. They have every time. Now I need a former New Yorker to step up, President Donald Trump. President Trump, is as simple as this. This is a moment where you could actually help to save your hometown, or you can turn away and you can fail to protect New Yorkers. And right now, you are failing to protect the very people who you grew up around, the very people who gave you every opportunity you had in your life came from New York City. But when New York City is in need, where are you? It's as simple as this. Right now, in Washington, the Senate, the House, they're discussing a stimulus bill, Stimulus 3.5, that would provide relief to New York City and cities around the country and states around the country with a simple concept. If these cities and states lost all the money that they use to provide the most basic services, police, fire, sanitation, education, you name it, if we've lost billions upon billions of dollars, how on earth are we going to support and protect our people? How are our public hospitals going to function? How are we going to ever restart the economy if we're billions of dollars in the hole? So what's happening right now in Washington is the discussion of adding to the stimulus money to support state and local governments so they can get back on their feet, so they can actually move forward to that restart of the economy. The House, under the leadership of Speaker Pelosi, is 100% ready to move forward. Senate Democrats, under the leadership of Chuck Schumer, are 100% ready to move forward. Senate Republicans are trying to stop aid to cities and states around the country. And let me remind you, blue states and red states, they're actually standing in the way of people of all persuasions, all backgrounds, big states, small states, every part of the country getting the help they need to get back on the feet. So the Senate Republicans don't want to act. They don't want to protect New York City or any place else. But you know what? Literally, with the snap of his fingers, Donald Trump could fix that. If he would just say the word, the Senate would jump. But the president's been silent. So President Trump, what's going on? Cat got your tongue? You're usually really talkative. You usually have an opinion on everything. How on earth do you not have an opinion on aid to America's cities and states? How on earth do you think that New York City, which has been the epicenter of this crisis, can get back on our feet without federal support? I remember famously in the 1970s when one of your predecessors, Gerald Ford, didn't care to help New York City during the fiscal crisis. There was that famous Daily News cover that said, "Ford to city, drop dead." So my question is, Mr. Trump, Mr. President, are you going to save New York City, or are you telling New York City to drop dead? Which one is it? But you have to speak up now, or the Senate will not act, and we will not get the help we need. It's as simple as that. So the president, instead of speaking to the issue that would really help, somehow amazingly silent on the stimulus, he has been very quick to tweet these slogans like, quote unquote, liberate Virginia and liberate Michigan. Well, I say, how about liberating New York City? How about helping us get back on our feet? Right now, you could liberate us by sending us test kits. You could liberate us by sending us stimulus aid to make up for our vast budget gap. You could liberate us by helping us to restart our economy, but we can't do that without our cops, our firefighters, our healthcare workers, our sanitation workers, our teachers. We can't do that if we don't have any money to pay for the most basic services of any city in a civilized country. So, I think I've made the point. The president has one chance to get it right here. One chance. And so far he's silent. Time to speak up, Mr. President. With that, let me say a few words in Spanish to conclude, and then we will turn to our colleagues in the media. Nuestros trabajadores.
This has been a special report from CBS 2 News. We now return to our regular programming.